Dr. Jaee Parvatkar. I'm a proctologist and an anorectal surgeon practicing in Mumbai. Many times I have seen patients being afraid, being embarrassed, or being skeptical about entering a surgeon's OPD to show their piles, fissure, or fistula problem because they don't know what the examination is going to be like. So they rather take over-the-counter drugs or any other quack medicine which simply prolongs the problem or aggravates the problem. So today I'm here to tell you what actually goes on in an examination process of piles, fissure, fistula. I'm here to bust a few myths and give you as much as information as possible. We'll start with the do's and don'ts. First of all, the don'ts. Don't self-diagnose. When you think that you have piles, you have fissure, you have fistula, and you create that own self-diagnosis, it might not be so at all. So let the doctors, let the experts do the examination, let them do the inspection properly and come to a right diagnosis to help you better. The second don't be embarrassed, don't be afraid to talk to your surgeon about the entirety of your problem, how grievous is the problem, what are the most pressing factors, what are you most worried about. The more you tell us about how things started and what causes you greatest discomfort or mild relief, the better we can treat you and the faster you will get well. Now we'll start with what actually happens inside the surgeon's OPD when you come. So when you enter the OPD, obviously there are some questions regarding what is the problem, what is the most pressing issue, what is the most aggravating issue that you're facing right now. Also, there will be a brief questionnaire about your past history, your surgical history, any drug allergies, if you have any comorbidities like hypertension or diabetes or drug allergies or anything in your medical history that your surgeon needs to know before prescribing medicines or advising you surgical intervention. Now comes the dreaded part, the examination. We will ask for consent before we examine you. Please say yes. Because when you say no, we will still give you a provisional diagnosis, but that's like firing in the dark. It is absolutely below par and it won't help you in the long run. So consent to a proper examination. What will this examination be like? Surgeon will ask you to lie down on his or her examination table. You will normally face the other side with the disease part, that is the butt area facing towards the surgeon. The lower half of your clothes will be slightly pulled down. You will be asked to do that. You will be given a sheet if you feel so inclined or if it makes you more comfortable. Then the actual examination takes part in 4 steps. Step number 1. We see the perianal region, that is the region around your butthole, to see any sort of discoloration, any sort of induration or pus or tenderness or external opening of a fistula or any other pathology that is of infective nature, so that can be dealt first. Point number 2, we watch the anal verge, that actually means the butthole. There we can find fissures, acute or chronic, papilla, external tags, thrombosed piles, and many such other pathology that needs proper inspection so that we can tell you if you need surgery. Point number 3, we will go and ask you before doing a per rectal examination using a gloved index finger and copious amounts of lubrication with maybe Log's jelly or any other jelly that is available to each surgeon. This per rectal examination with the index finger is as good as any ultrasound for a proctologist. When we put our fingers in this index finger inside the anal canal, we feel for any pathology like internal opening of a fistula or any other papilla or any other pathology, but we mainly look for the anal tone, that is the tone of your sphincters that make the anus, that make your continence, from which you can have proper defecation or control over your defecation. A good anal tone will speak volumes about your anal health and how your disease is progressing and what should be the course ahead. The last thing that we do is take consent for a proctoscopy. A proctoscopy is basically a scope that is, just a second, this is a proctoscope by which we conduct a proctoscopy. The anatomy is like this. Sizes differ for pediatric to medium size to large size. Material may differ. It might come in plastic or any other material, but this is the normal anatomy. With proper lubrication and a gentle hand, experienced hand, this is gently introduced into the anal canal with copious amounts of lubrication. The obturator is removed, and then we can watch inside the anal canal for any pathology like hemorrhoids, the size of hemorrhoids, bleeding if is there, or any other papilla, any other pathology that we might actually see to know better of. That is it. That is what entails a proper proctology examination. I hope I have given you a brief idea of what goes on so that you might know better the next time you come to a proctologist. Also, please go to your surgeon, go to your proctologist to show this problem, to discuss this problem. Don't be afraid. The more you are afraid, the more you're prolonging it, the more you're aggravating the problem. So, come to doctors like us, tell us your problem so that we might help you. For more such information in proctology, follow me.